but I'll start that. And then let's just wait another minute or two and see who else makes it in. I know it's the end of the
Mhm.
semester, so we might not get everyone, but I'm really excited about this. I want to hear. I mean, it's a little bit selfish of me, but I really just want to know about what you're doing.
Oh, cool. Hopefully, you won't fall asleep or get bored.
Well, I'm sure I won't. Hmm.
Yeah. I'm getting some messages from my undergrads.
I had to do jury duty this morning, and luckily they excused me, but I used an animal study as my excuse. And I said that none of my undergrads were available because it was finals week. So no one could step in and finish the study for me. Um,
Yeah.
and the judge was like, done, scram, get out of here. We're done with you.
Yeah. Do you have to go in person? You did this at the level of like you got called in and
I
everything?
got called in. Yeah.
Yeah. When I was like just a week away from defending my dissertation, I got called in, and
My God.
as soon as as soon as they heard that I was like a PhD student, they didn't want me anymore.
Hmm.
Sometimes they say that you're a scientist, you can think for yourself.
Yeah.
You like to do your own research, and the usually the defense will drop you.
Yeah. Dr. Charrington told me that I should say, not only can I be an impartial judge, but actually I can explain everything to everyone else. And that if I seem to be a pompous enough know-it-all, then they'll dismiss me. I thought that was helpful advice from him.
Good. Did you want me to share my slides or anything
Yes,
while we
please. You
wait?
should
Or
be able to
I
share.
don't know. Okay. Okay, I'm gonna share my second desktop and then I'm gonna hit this.
Okay, excellent.
Okay, does it look like audience view?
Yeah, it looks good.
Yes.
Um,
Yes, good.
okay, so I think we have probably three or more people who are gonna roll in as other meetings end. Um, but I guess I'll start introducing you and we can get started. So Dr. Zelieann Craig is a member of my committee, which I'm very grateful for. And she just won this amazing grant to do phthalate research. And she is essentially my local cornerstone when it comes to endocrine disruption and understanding endocrine systems in women's health. And she's an associate professor in comparative biological sciences and animal sciences, I believe,
Mhm.
and is from Puerto Rico and has studied there, but also at the U of A. And I love her. And here she is to tell us about her work.
Oh, thank you so much, Sophia. I am from Puerto Rico. I am not related to Bad Bunny, and if I was, I will not be happy. Sorry for those if any of you likes him, but I don't. Thank you so much for this opportunity. If it is my understanding that you guys have these great meetings where you kind of talk science, and I think that's amazing. I really love it. All the things that graduate students do together, like you guys are definitely the glue of research. If not also the kind of the workhorses, what really keeps it going. So as a faculty member, I really love working with graduate students, and I'm very thankful for all the energy and the ingenuity and curiosity that you guys all bring. So it is kind of like double honor to be here with you guys. So a couple of things. I am not a pharmacologist or a drug developer, a drug discoverer. I am a toxicologist, so I'm a kind of like on the other side of things, like, trying to understand how things can be a poison to the reproductive system. And so right now, today, I didn't want to bore you with like a really long talk, so I just took an excerpt from a seminar that I gave University of Illinois Urbana-Champaign, um, sharing some of the work that I've done elucidating mechanisms of action of phthalate exposures. But interestingly, what we're trying to do is not look at the poisons in the traditional. So you hit it with increasing amounts that are linearly arranged over, the x-axis in a way, but they're actually epidemiologically relevant. So when we're treating animals with phthalates in these experiments, we are using human data to drive the decisions that we make and how we pick those doses and kind of how we study them also. So I'll go ahead in there. So phthalates are endocrine disruptors, and so I have a little bit of an introduction here. So you might have heard before, it is estimated, and now the estimate is actually higher. I heard somebody recently say that it is estimated that there are 100,000 chemicals in use worldwide. I feel more comfortable with the 85,000 since I don't have the source for that new number. But and this is ranging from everything that it's a compound in our environment, in our lives, medications, cosmetic products, pesticides, food additives, everything. And the Endocrine Society, which is an authority on understanding of the endocrine system, estimates that of those 85,000 chemicals, approximately 1,000 of them are known to perturb the endocrine system. And the endocrine system, you might have heard, we all carry one around. Sometimes as a friend, sometimes it's very annoying, and sometimes it helps us survive situations like a ginormous piece of cake or a potential rattlesnake in the yard. So the endocrine system are these series of organs and glands that are distributed throughout the body, and they help us regulate our function. And the endocrine system, I've always thought it was fascinating because it communicates chemically, and it works, pretty close with the nervous system, which is the master regulator of the body. So we have this kind of like wired version of it in the nervous system, but then the endocrine system is kind of like the chemical version. I like to think about it as a little bit like Bluetooth. And so we have all these hormones that have these functions. They can regulate a variety of things from our growth and development, our metabolism, and our reproduction. And so in my lab, we're very interested in reproduction. But recently, some of our studies are actually taking us into the interface between reproduction and metabolism as well. But today, what I'm sharing with you is very rooted on the reproduction side of things. And among the two sexes in my lab, we specialize on understanding female effects, but we have collaborators that are actually looking at effects on males as well. So the chemicals that I'm talking about today are phthalates. These are ubiquitous chemicals, so we can find it everywhere around us. They exist in various congeners that are basically the same initial structure of a phthalic acid. And then they have different types of branches, which gives them kind of like a different personality, a different use. They are lipophilic based on their structure when they are their parent compound form, and they can cross membranes easily. Interestingly, they don't bioaccumulate. So we know our bodies and the bodies of laboratory animals are really good at getting rid of them. Makes it more concerning when we're able to detect them all the time in nearly all human samples, because that means that we are constantly exposed to them. They are cleared very well via urine, and if there's a backup in our ability to excrete our livers are pretty good at putting it into bile as well and getting rid of them through the feces. So this slide here shows some examples of the products in which they can be used. Traditionally, food packaging, plastics, also be additives and cosmetics or personal hygiene products. They also can be showing up they show up in IV bags, dialysis equipment, a lot of medical devices, and one specific phthalate, dibutyl phthalate, which is the one I have studied the most, actually shows up in the plastic coating of medications that need to have an enteric release. So anything that is specially coated to make it through and release in the small intestine. will actually have dibutyl phthalate or a substitute for dibutyl phthalate. Upon entering the body, phthalates, most of the time they are oral exposure type of chemical. They get to the intestines, they undergo biotransformation with esterases. The first thing they're going to do is kind of chop one of their arms. So they go from diester parent compounds to monoesters. And so here you have the example, we have some example phthalates here. It's the parent compound. They go through the intestines. Some of them undergo this biotransformation in the liver as well, and they'll lose one of the arms. So they'll become a mono, whatever the name of the phthalate, right? So I mentioned dibutyl phthalate here. So once it's clipped, it's monobutyl phthalate, and that starts increasing their water solubility. They get absorbed, they go through the liver, they can get oxidized, they can get glucuronidated, which will also help with their excretion. Unfortunately, they're still able to kind of get into cells and kind of cause problems. And I mentioned human samples, the CDC has been tracking them since 2001. And so since then, they keep showing up in the urine of Americans, as well as being higher in women. And more recently, all over the world, people have started using ovarian follicle fluid. So when women go for assisted reproduction in the clinic, they can have their ovarian follicles popped and to get eggs for IVF or any other procedures, and then that fluid can be assessed for different chemicals, and phthalates are showing up, and they are associated with having poor outcomes at the fertility clinic as well. So we know that humans are exposed to them frequently enough that they show up in nearly all samples that get tested, and that they're actually getting to the ovaries. So, and that takes me to the organ of interest in my lab, which is ovaries. Uh, some basics of ovarian function. The ovaries are two almond-shaped organs at the very end of the fallopian tubes. And the fallopian tubes are attached to the uterus, so that forms a reproductive tract. And inside of the ovaries, we have functional units, and those functional units are called ovarian follicles. And if you kind of have an expertise in a different tissue, the equivalent of this is saying, the ovarian follicle is to the ovary what the nephron is to the kidney, or what the alveolus is to the lung, or what the neuron is to the nervous system. So they're the functional unit. You can reduce the function of this organ to these guys, right? These cell compartments that have an egg within them and a series of epithelial cells surrounding it that will make hormones and keep that egg and help it grow so that it gets really large and it can actually ovulate. So here are a couple processes, that are important in the ovary. So these antral follicles is the follicles when they get really big, they develop this fluid-filled cavity and they have the egg inside. So these guys are very important for the maturation of the eggs and they release estrogen. So in a human being, these are the guys that are making estrogen for women. And then when they receive hormones from the pituitary, which I'll show you a little bit more later, they actually can rupture and release the egg, and it gets picked up by the fallopian tube, and it can travel, in the fallopian tube. It could get fertilized, and then travels to the uterus, can get implanted, and then we have new life. So the ovary has these two responsibilities, which is maturing, well, three basically: egg maturation, releasing the hormones, and releasing that egg for fertilization. And so when we have issues with those, then we have issues like menopause, early menopause, hormone disorders like estrogen deficiencies. Also, on the other end, if too many antral follicles are stimulated and they're making too much androgens, we can have something like polycystic ovary syndrome. Overall, if ovulation is inhibited, we get infertility, low pregnancy rates, and we can actually stop having periods and things like that. So, unfortunately, epidemiological studies have shown that phthalates are related to each one of these processes in negative ways. And so the next slide, I'll show you some examples. And here I have it broken down based on where the evidence is coming from on wait, the left side, the data based on urinary levels. So these are studies in which people have measured urinary levels of phthalate metabolites. So at this point, we're looking at the glucuronidated or the diet monoester and looked at the higher the level of phthalate they have in their urine, whether that's associated with some outcomes. And so a lot of them have to do with ovarian function, like an increased risk for menopause. When women have high urinary phthalates, they have a low antral follicle count, which are those follicles that are very important for making estrogen and ovulating. They also had less ovulation and an increased risk for pregnancy loss after assisted reproduction, which is terrible because after women have gone through all the treatments and everything, they are unable to have a pregnancy in the end. And other studies did the same, but actually looking at levels of phthalates directly in the ovaries, which I think is even, more convincing evidence. And they found also low antral follicle count, low ovulation, low hormones. The studies were not done together, so they're not really exactly matched, but they're kind of building the same picture that phthalates are not good for the ovary. And this is all human data. Um, so in my lab, I actually looked at that information and I said, well, are these phthalate exposures, are they in those health outcomes that have been documented in the literature as like happening in women? Can I replicate that in a mouse model and use that mouse model to determine if those effects, kind of how they're occurring? Are they direct effects on the ovary or any of the other organs that communicate with the ovary? And if we can get away with that, like actually we can look at cellular and molecular mechanisms, how it's right, which is kind of like the meat of what a toxicologist would want to know, is kind of develop this picture on what is going on with this poison. So I'll show you some studies we've done with phthalate exposures. We started phthalate. Now we have experiments that we've done 3 phthalates together, and I just got funding to do 9 phthalates together. So as the field moves more into mixtures that more closely replicate people, but I'll show you the DBP in just a little one. So this, I mentioned before, dibutyl phthalate. We were very interested in this phthalate because it's the highest in urine of women of reproductive age. And one thing that maybe if you are familiar with phthalates or have heard of them, you might have heard that their levels in people are going down with more knowledge, more intervention, regulation, and things like that are causing phthalates to go down. So I recently went to the CDC's and Haynes database and I started looking at multi-year exposure, and you can see them going down. One thing that you see though is that women still have higher levels than males. So even though they're going down, the sex difference is still there. So it's cool, right? Well, doing this massive intervention and helping everybody get rid of phthalates, but for some reason, women always have higher levels. So um, it keeps being detected in human follicular fluid, basically similar levels. So we know that it's high in follicular fluid. It affects antral follicles, which was the ones that ovulate. And so we were very interested in understanding this at really low doses. And um, I'll talk a little bit about dosing considerations right now, but hopefully to convince you kind of why we use crazy doses in experiments that are not like traditional, like maybe tenfold increases, like in a linear way. So when we developed this model, I really wanted it to be estimated based on estimated human exposures. So from all the original studies that characterize dibutyl phthalate, for example, the National Toxicology Program, they will create these chemical profiles that tell you everything that is known, during that period of time about this chemical. So we found how much is estimated that the general population gets, occupationally exposed individuals, as well as people taking medications. And the medication exposed people can be quite high if you're taking a medication that is coated in DBP. You're basically taking a DBP pill. Now, it is very important to understand, though, that these medications, always have to look at the benefit and risk ratio, like proportion on something, right? So a lot of the The medications that I'm aware of that will contain DBP, they're used for Crohn's disease or IBS and things like that. So definitely there's a lot of suffering that comes with those conditions. So, there's a little bit of a negotiation that a patient needs to make. So I don't speak against taking a medication that is coded with DBP if it's actually improving somebody's life in other ways that are more critical. But then those people will have quite a bit of exposure. So we wanted to have our exposure based on that. Also, we needed to pick a route. So we picked absorption via oral ingestion, and we wanted the levels to be close to what people have in their follicular fluid from all those studies that I mentioned before. We know that that's a range between 1 to 12 nanograms per milliliter, so it's very, very low. And finally, we wanted our dosing regimens to be very tied to the reality of phthalates being ingested, or people being exposed to them frequently, daily, because they do not bioaccumulate. The length of the exposure to ovarian function. It is very interesting working with females. I don't know if any of you work with animals, or you work with women or anything like that, but when you work with females, the your animal or your herd not be the same across the reproductive cycle, basically in terms of the hormonal milieu and things that are happening to their bodies. So a lot of toxicology studies will use, they say, okay, we dose the animals for 20 days and then we collected. But then and all the females are going to be in the same stage of the cycle at the end of those 20 days. Some of them might be close to ovulating, some of them already ovulated. So, and we know that the change in the hormones throughout the cycle exerts very significant changes on the different organs. The uterus being the classic example. When an animal is getting close to ovulation, they secrete a lot of estrogen, and that estrogen makes the uterus plump and juicy. Like, if I don't know if you've ever had to dissect an animal with had like a uterus, and I know it's like a weird way to call it, but they look fluid filled, bright pink, lots of blood flow. And then after ovulation, when the animal is done with that, the estrogen drops down, we have more progesterone in the system, then that uterus is gonna dry up again. Okay. And it gets smaller, kind of yellowish, boring, very thin. And if you actually get an animal through like ovarian senescence or menopause, like when they get really old, or if you treat them with a chemical that gives them menopause, the uterus is almost disappear. It looks like a little string, like a little hair. So now understanding that there's tissues and that the body reacts differently to the hormones is very important to consider the reproductive cycle when you're dosing for toxicology. So that's one of the things that we did also. We tied our dosing regimens and their length to ovarian function. So, for example, mice ovulate at night. So we need definitely to make sure that when we're dosing animals, that their dose of phthalate is high during the time of ovulation at night. So I don't think I have any of those studies here, but there were studies where we had to dose twice a day so that the phthalate was high overnight when they're actually ovulating. So, does that sound good for everybody so far? Am I doing okay with time? Am I taking too long to get to you guys' questions? Okay. All right. It'll go faster now. All right. So the first thing that we did was, okay, we definitely need to do like LCMS or something to measure, like after we feed the animals, the parent compound, dibutyl phthalate. We know it's going to go through the gut and then be turned into monobutyl phthalate. So the main question was like, if we feed animals with dibutyl phthalate, do we pick up the monobutyl phthalate in the ovary? And that will tell us that it is getting there. And so we did study with adult mice, and they received different daily doses of DBP. We did a single dose and a 10-day dose experiment. I'll show you the 10-day dose in this talk. And then we did time collections on ovaries. We also measured liver and serum, and they were very similar with the results, just a little shifted in time. And then we sent them to the Cancer Center for the analytical chemistry shared resource, and they measured monobutyl phthalate on there. And what we saw was that we fed animals with DBP, and then we detected MBP in their ovaries. And that MBP was proportional to the amount of DBP that we gave them. So if we gave them very little DBP, the animals have almost no ovarian MBP detected. But if we gave them more, we had a middle dose here, 10 milligrams, and then 1,000 milligrams, so a gram. We gave them quite a bit. And then so we saw the difference between the two. And we saw that it was already peaked by 2 hours and that they clear it. it. It gets to the ovary, it leaves the ovary. So um, we were able to see that dynamic. We also know that based on these median human follicular fluid levels of MBP, we know that we wanted to be between 1 and 20 grams per milliliter. So we discovered that if we gave the animals anything below 10 milligrams per DBP, will definitely keep us in that range if we're doing a 10-day study. So this was really cool to know that we could see it going there. So we're getting close simulating the human exposure in the mouse. Now, in terms of experiments, I know that Sophia mentioned a lot of like neuro interests, I think, right? So I wanted to share with you kind of like some of our newer stuff that we're still thinking about, and that has to do with the control of ovulation because it's controlled by both the nervous system as in a neuroendocrine control fashion. And beyond what I'm showing, well, let me pull up the screen, like the first part of this. Ovulation actually is controlled by the communication between the ovary and the pituitary and the hypothalamus, right? So there is a neural aspect to ovulation. There's a neuroendocrine, right? And then there's the endocrine part. So we have a little representation of all the different feedback loops and control pathways. So the hypothalamus will release this hormone called gonadotropin releasing hormone. And it does that in very interesting, cool ways. Like it has these patterns of secretion and stuff. And then that travels just a short distance to the pituitary gland, specifically the anterior pituitary gland, where it will bind to its receptor and it will trigger, depending on the frequency of the pulses, one of two hormones. I'm going to talk about this one of them only, which is called luteinizing hormone. We lovingly call it LH. And so when LH gets released from the pituitary, it travels through the body to the ovary. And when we're getting ready to ovulate, the ovary is going to make so much estrogen that estrogen is going to feed back to the pituitary and hypothalamus and just trigger a massive bolus of this hormone. It peaks. It gets really, really high. Normal, we get a normal release that allows you to produce hormones and stuff. But when we have a really big follicle that is pumping a lot of estrogen, this LH surge, that's why I put it big, is massive. And that will come back to the ovary and prepare this ovarian follicle for rupture. And there's a very fascinating cascade of events, and it's amazing. And there are videos out there that show you how it happens. It's pretty amazing. And so then we got the release, egg release, ovulation, fertilization, we're all good. Now, so what I want to show you today is like these studies where we use different approaches to understand whether phthalates are affecting this process. Okay, so the first one I'll show you includes a couple of types of treatments. So we'll have what I'm going to call natural, which are intact animals that we were just sitting around waiting for them to ovulate. Then we also have stimulated animals where we gave them exogenous hormones. So basically, we gave them another hormone and LH to kind of get them to ovulate a bunch of eggs. We had animals where we removed the ovaries and we gave the phthalate treatment and the hormones to stimulate the pituitary to produce an LH surge. And this will tell us whether the animals are being able to ovulate. If we bypass the pituitary, can we get them to ovulate? And then if they have no ovaries, can we stimulate the pituitary? Will the pituitary still be able to release the LH surge and phthalates? So these studies were done by my student, Lindsay Rasmussen. And basically the idea here was we were trying to understand how maybe phthalates are impairing ovulation in women. So she did the study that I just described. She had two branches, natural ovulation, where we have all these different doses of phthalate that we gave the animals, and another group that received the same doses, but instead of us watching them ovulate on their own, we stimulated them. We gave them the hormones, the pituitary hormones, to get them to ovulate when we wanted them to. And then we bred them and we checked for ovulation. Some of them were ovulated, some of them, because they were bred, they actually had zygotes or fertilized eggs that we could count. And we compared different parameters like ovulation incidence, egg yield, fertilization rate, blastocyst rate. Blastocyst rate is kind of like the 4 or 5 day embryo that kind of tells you, we're ready for implantation. So, like, let's say if this was a clinic, we would, our patient will come in, we'll stimulate her, collect her eggs, IVF them, and then then these embryos get to blastocyst stage, then we put them back into the patient, right? And I say we, but I'm not a clinical person. I just feel like I'm part of the the community. So okay, so here's the data. So there's like three pieces of data here. There's the incidence, the yield, and the fertilization. So in the incidence here, we'll have the percent of mice here in the bottom and the different doses of DBP. And blue means we saw ova and zygotes. Red, we didn't see any. So, for example, here, the control animals, we had 90% ovulation. 90% of the animals had some eggs released or zygotes. There's a 10%, which is not unheard of. Some of them may have not, ovulated, or maybe they were delayed. And then the phthalate treatment, we saw that as the phthalate treatment increased, and this is not that linear, like there's a huge jump from here to here. They actually started, less animals started to ovulate. And so when we look at the yield, we can see all these zeros kind of piled up in the bottom. It makes our yield significant. This is yield means how many eggs per mouse were released, and that was reduced. And then when we looked at the fertilization rate, obviously we have all these zeros here, so that was also reduced. Now, if we remove all the zeros from the equation, something really interesting shows up, which is the fact that if you remove the non-ovulating animals, the animals that ovulate, their eggs are not bad. They actually released almost similar to control, and they also fertilize pretty good, right? So something is causing, this kind of tells us that maybe the problem is in getting them to ovulate. Maybe they need longer, maybe they just don't have enough of them, something else. So that's kind of where we started looking at the pituitary. So we followed this up with the stimulated ovulation, and we said, well, maybe the pituitary is just wimpy or something, or the ovary is not sensitive. So usually, what do you do when you have an organ that is not being sensitive? You just give it a whole bunch of the hormone, try to break it and see what happens. So that's what we did. And so when we did that, we gave them pituitary hormones that stimulate the growth of follicles and the one that stimulates ovulation. And the ovulation issue was fixed. So if we bypass the pituitary and give direct stimulation to the ovary, then we get the ovulation defect correct. Mind you, there was a few, uh, animals here that didn't ovulate. But then when we look at the yield, we have very similar yield between the groups, and fertilization rate is pretty close. So, wow, we fixed it. That's great. So it tells us that, okay, perhaps there's either a sensitivity in the ovary or the pituitary was not doing its work. And that's how we ended up in the neuroendocrine control experiments. So as a reminder, in here we have LH comes from the pituitary, estradiol comes from the follicle, it stimulates the neuroendocrine glands. Pituitary releases LH, and LH comes back to the follicle, and the follicle ovulates. So that's what we wanted to look at, this part, pituitary release. And we used this really old protocol I found in a book from the 1960s or 70s or something that my PhD advisor, when she retired, she just gave me all her old books, and I was like, oh my God. So I have all these really old books, and there was a protocol on how to do this. They did it actually with rats and hamsters, so we had to adapt it to mice, which was a little difficult, but we got away with it. And in this case, we use the animals, we give them DVP, and then towards the end of the study, we prime them with the hormones. So they don't have ovaries. These animals came without ovaries. So they can't do this estradiol stimulation. So we made it. We did it for them. So we gave them sub-Q estradiol. If you give them progesterone, it actually works even better. I don't know how. The 1960s book told us. So, and it worked. And so then we do serial blood collections before, during, and after that stimulation, and we compare the levels. And that's what the next piece of data that I wanted to show you is. Um, and I'm almost done. And so here are three pieces of data. Peak LH levels. So um, how much did they have at their highest level during the experiment? The time course is the levels. If we set the peak in the middle, how much did they had 2 hours and 4 hours before that, 2 hours and 4 hours after. And the last one is that area under the curve of those peaks to kind of see total release, a comparison of the total release. And what we saw is like when they got to their highest levels, they were pretty similar. They were able to release, technically achieve a peak that was comparable with their controls. When we look at the time course, we see that after the peak, the controls go down rapidly, which is expected. That's how the hormone should work. But the DVP treated animals actually kind of took their time to come back down. And because of that, when we look at the area under the curve, we see that they actually had a we call it total release, but basically it's like LH was hanging out in the blood a little too long, right? So they actually had technically they had greater exposure to LH, right? It stayed around a little longer. Um, so that's the data, and that's the thing. It's like, how are we gonna interpret this relative to like what our phthalates are doing? So I have data showing that to the ovary. I didn't know that they were getting to the pituitary. So if they become biotransform into the monoester, that which is a little bit more water soluble, how are we getting through the blood barrier to get to the pituitary? So that would be a great, conversation with experts on neuro. So have a summary slide real quick. The ovaries key to female reproduction, ovulation, hormone production, fertility, and the timing of menopause. The follicular fluid in the ovary is a window to the intrafollicular environment, and people keep detecting every single thing out there as actually one of those. So, various phthalates keep being detected in there, even though the trends are going low. And we've actually gotten pretty good at replicating phthalate exposures in mice phthalate exposures that are relevant to women in mice. We know that our mice replicate the ovulation defect seen in people, but there might be issues with the pituitary, not just directly the ovary alone, or maybe one or the other. We still need to figure that out. And the third bullet there is cellular molecular mechanisms. I didn't include that today, but we have really cool data on antral follicles themselves, showing that there are, issues with lipid metabolism from proteomics and lipidomics data that we have collected. So it's very interesting in there. So my lab is at the BSRL building. I have a lot of students that are not even on there now. I need to change my picture. But thankfully, I've been funded by the NIEHS, and I'll take questions and discussion.
That was great. Thank you. Um, One question I have is whether or not you have had a chance yet to rule out a hypothalamic mechanism. I would imagine it would be a lot easier for phthalates to access this whole system via the circumventricular organs, including regions of the hypothalamus, than by the pituitary itself.
Yes, so the hypothalamus, we have collected it and we did a little like a quick and dirty qPCR to see if there were any of the protein, like the genes that encode the proteins that will regulate the hypothalamic communication with the pituitary or anything that senses estrogen. And it was like flat out, like no changes. And we did the same thing with the pituitary. Now, the hypothalamus, we haven't done I feel like we would need to do like cannulation or something to be able to measure GnRH release because it's just, in that little portal system between the two glands. So to be honest, we shied away. We got intimidated. We just have
Okay.
little rats with a probe up here trying to get fluid.
Well, maybe Tally's the person to talk to about that because she makes us do that kind of thing. But
Mm.
yeah, one of the things that I was wondering about was if we have really just a change in the ability of estrogen to act on estrogen receptors to change GnRH signaling rather than downstream with LH. So that'd be
Hmm.
interesting to find out.
Yeah, and dibutyl phthalate actually has been shown to bind. I think it likes. Well, let me stop sharing. I think it likes estrogen receptor alpha quite a bit.
Do we know
And
if there's interactions with G30?
I don't know actually. I might have known at some point, I don't remember, or I just haven't really
Okay.
I haven't looked at Jeeper.
No,
Yeah.
that'd be really interesting to find out.
Hi, Dr. Craig. I have a quick question for you. So, kind of going back to how you calculated the dosing for the studies that you did,
Mhm.
I know that you mentioned that that calculation included looking at human data amount of phthalates that humans are consuming, on a normal
Mhm.
basis.
Mhm.
My question is, based off of that human data, do you see any threshold at which phthalates are not an issue in terms of affecting the endocrine system, or is it more of like a no phthalates at all? We should not be using them, consuming them.
It is really crazy. And actually, I'm gonna pull up a slide. I think I hit it. So you see, so the short answer is phthalates are hard to regulate because they will be safe at, like, depending on the endpoint that you're looking at.
Mhm.
Sometimes the highest dose is going to look just like the control, but if you go down in those, then you see effects pop up.
Hmm.
And so, because I don't like to just tell people, I'm going to look for an example so you can decide if you believe me or not. These are some sites that I hit for time, but here's an example. And actually, the ovulation one has a pretty good example here too. No, I think I'm gonna show you guys this one first. So this one we were counting follicles. So we take the H&E sections of the ovary. Are you able to see?
I don't think so.
Uh, I wondered. There we go.
Okay.
Let me see. Do I want to share screen? Okay. All right, so we get the ovaries and then we count all the different types of follicles in there. So anthers are the ones I was saying that are the most important ones.
Hmm.
And so, like, if you ignore these two bars here, you look at the control and the 1 gram. This is 1 gram of DVP daily, um, per kilogram of body weight. You would say, oh, this chemical does nothing. We're good. But because we went down to 100 micrograms and 10 micrograms, like these two are well within the human range.
Hmm.
And they are, you know, the antral follicles were down. And so this is the first time we saw this. And we were like, oh, huh, interesting. Oh, well, everybody said that data must be wrong. You must be kind of crazy. This is not right. Because then how do I extrapolate a reference dose or a safe dose out of this?
Right.
I don't know, right? And BPA does that with prostate too. It's pretty crazy. Let me unhide this one and show you this one. So this one is another thing that we did. So we bred the after DVP, we stimulated them to ovulate a whole bunch, bred them, and then grabbed the zygotes and let them mature in vitro, kind of like they would do at the fertility clinic. And at the end of the 3 days, we looked at the classifications of the embryos. By this time, we want them to be blastocysts. And in fact, if you look at the 0 here, which is the control, these embryos were grown normal. They didn't get further treatment. The what you recover at that time are blastocysts. These guys are good to implant. When we look at the 1000, which is that 1 gram one that didn't have issues with the antral follicles, they look pretty close. They look pretty decent. There's a lot of blasts. If they're not blastocysts, they're morula, so they're coming up, slightly delayed, but they're coming up. So you say, okay, we just wait one more day and these guys will be fine. But then when we look at the middle, 10 and 100, they have a lot of fragmented embryo going to be successful. Humans, we're pretty good at making babies out of fragmented embryos, but it's not always a good thing. So for mice, it's pretty chaotic. But see, this is a whole different study, whole different animals, different dosing study, different endpoint, and we still see that pattern between those two. And we have a lot of examples where, particularly this dose right here, the 100 micrograms, it causes problems, whereas this high dose is inactive. So long answer to the question, but I wanted to show you the data. And it happened with gene expression. It happened with other things in independent studies. We are very convinced that you have to be in a specific dose range to see the effects. I don't know what would happen beyond 1 gram, beyond this, but it might make you feel like it's super safe when we know these experiments, just because the way we designed them, we're learning that they're not. So
Wow,
yeah.
that is very interesting. So I can see why you say it makes it hard to regulate the amount
Mhm.
because, yeah, if you're looking at control versus the other extreme and they look the same, then it's like, oh, well, it's not an issue, but it's those intermediate doses that are
Mhm.
causing problems. So that's very fascinating. Thank you.
Yeah, very good question.
I have a follow-up question to
Mhm.
what you're saying about that really high dose.
Mhm.
Is is that really high dose of like 1 gram causing some kind of inflammation, so like an immune reaction? Maybe that's like the mice are clearing it more quickly versus like maybe the lower doses are flying under the radar and can exhibit their effects. Or have
Yeah,
you
and
seen any like inflammation or immune reaction from such a high dose like that?
we haven't measured inflammation. Other phthalates that have been studied have a really good inflammatory oxidative stress type, signature. And you really hit one of the theories right on, which is we think that the high dose is it's so potent that it activates, it probably induces the biotransformation enzymes, and we get a lot more clearance of the dose, whereas the low doses actually can, don't exert that same activity. So in the end, when you look at it, they're actually lingering a little bit longer. They're also at low doses as well. They're at the same dose range as the natural hormones. And so some of the endocrine disruption theories out there talk about the ability of activate different processes, right? So then the low doses might actually be working more with the endogenous receptors, etc. Whereas the high dose is like a hits with a hammer. All systems go into alert, and it causes probably triggers a really strong repair response that, by the time we measure it, we see kind of stability. Whereas the low doses are just hormones interfere with the hormones or just touch a variety of pathways.
Yeah, interesting. Also, another kind of follow on to that. You said that the phthalates or the metabolites are lipophilic, right?
The
So
parent
they,
compounds are, pretty lipophilic. They can
the
cross
parent compound,
over.
yeah. So is that maybe another aspect to where they, can hide in fatty tissues and persist longer, and also maybe is could be related to why they're apparently higher doses in females that you were saying versus males because of the lipophilicity.
Yeah, those are really cool ideas. The I think we haven't seen too much support, like in terms of data for accumulation. They get cleared really fast. Every single study that has done, mind you, they haven't done female. So let me tell you a story about DVP and how we know how it moves around the human body. There's these studies from Germany where they had people take a pill of DVP, pure DVP, and then I suspect it was probably the PI of the lab that did it like desperately. They take a pill and then they had, pretty much everything measured, blood over time, urine, fecal. And so they studied that, but they were male subjects, right? So we know we have a really good idea of how they move through the body. They clear really fast. In male suspects, female data, we have rodents only. Until I did my study, the only data available was pregnant rats, which is pretty different, as ADME changes quite a bit and during pregnancy, technically. And then, so yeah, so we know that it doesn't seem that they're accumulating. You can recover pretty much the dose based on what's lingering in the serum on a tissue or what came out in the urine. So that part is a little bit more. And I forgot part of what you said, something else that I really liked that I wanted to address, and I forgot actually. A little tired today. So you mentioned the
Uh,
lipophilicity, and then
yeah.
there was something else. I should write
Uh,
things down.
my last question, I don't know. I forgot to.
It might be going along to what my question was, because I had a similar thought
Okay,
in
go ahead.
that women have a higher average body fat percentage. So, like,
Okay, yes.
since you said that it's been found in higher percentages in women, was that data standardized for body fat percentage?
I don't think that it is. They only creatinine adjust, so they adjust to creatinine. Now, okay, so that's the other thing I was gonna say. In the field, we're looking at not necessarily like differences in the body composition. I don't think anybody has done that because I think once they figured out that it was not accumulating in fat, like they just kind of like walked away from that, which, is one of those things that maybe needs to be revisited later. Now, a lot of the hypotheses are centered on product use and how women are more exposed to beauty products, cosmetics and things like that that have phthalates in them, especially fragrance. I didn't mention this at the beginning, but phthalates actually can't be in fragrances. They're esters. They actually smell good. Not that I sit around in my lab smelling the phthalate in my lab, but I've opened a bottle and felt like it smelled like perfume. It's based on the use. So it's like the exposure routes are more favorable for female exposure. Additionally, for dibutyl phthalate, the medications that are coated with butyrate, for like Crohn's, IBS, women are more likely to be treated for those and be suffering from those. So there are all these different hypotheses. I don't feel like there's what do you call it, like final evidence. Are these hypotheses, and I don't know, like people that have access to human populations and can do mass spec regularly will be able to kind of go for those. So I think that's kind of what we know, like in terms. My past postdoc, she's starting her lab at Midwestern University and she's looking at sex differences. And one of the things that we've talked about is like you need to get to the ADME questions to see if males or females are metabolizing phthalates differently and if they clear them differently. And that will definitely kind of feed, into answering some of those questions.
Well, one way to potentially answer that would be just to get a whole bunch of women who wear or don't wear makeup and measure the levels in them. And so, if you or anyone else decides to do that, I sign up Melissa and I sign up me. You can go ahead and
Aw.
measure our phthalate levels.
Yeah, there's actually a company, it's called Million Marker, and it's kind of like Ancestry. You send your sample and they will measure and send you a report of like what your levels are and like what you can do. They measure all kinds of things though, not just phthalates. So I've been wanting to send my samples to that. I'm afraid to know. Um, I think one of the things though, there's a study that they were looking at interventions for reducing endocrine disruptors, and um, they I only got the information from a poster at a little mini conference online that I went to, and I'm looking forward to the publication. But they did several interventions. They told people like, okay, wear things that say no phthalate, and there was another group that they say wear nothing with fragrance. And at the end of the study, what they found out was that the people that avoided fragrance actually had lower phthalate levels than the people that were avoiding phthalates as a label. So it tells you like how where they are hiding, and it tells you that you can change your exposure by avoiding fragrances, for example. So I think that would be a good one. And also seeing if there's a difference in the composition of fragrance. And unfortunately, they're trade secrets, so you don't get a list of ingredients. Like if male and female fragrances have a difference. Like I think phthalates are more on the fruity, kind of female-y kind of sense. So maybe the male stuff doesn't have that much phthalate too. So.
This is kind of reminding me of the delimiting carcinogenicity study with it's only carcinogenic for male rats,
Mhm.
basically. Because the the cancer promoting ability of delimiting comes from it interacting with a specific protein that's really only expressed in rats and it's suppressed by estradiol. And so it'd be really interesting if there are um, similar mechanisms here, but in reverse for males versus
Mhm.
females of having suppression of mechanistically required proteins by
Yeah.
androgens. That would be really interesting.
But that's actually so scary though, because then women undergo menopause, lose their estrogen, and now their risk changes. And like, are we picking up that in regulatory toxicology, or are we just forgetting about menopause women once more time, one more again? So it's crazy. That's the fight of menopause. There's a lot of things that say like, oh, this doesn't affect women because estrogen does this or that, but then what happens at menopause? So it's a very important thing to think about.
Another question for you. I know you mentioned that the metabolism hasn't been fleshed out, and I'm sure it depends on the specific phthalate as well. Do you know if it's more hepatically or renally metabolized overall?
Yeah, so first pass, it kind of has a, um, I don't want to call it first pass and confuse it with, liver, but it's like pre-liver metabolism. The lipases and esterases in the enterocytes in the gut will start, the phase one metabolism by clipping one of the branches. And then in the liver, most of the metabolism is oxidative. And, obviously we can do the glucuronidation. So it will be kind of more of a little bit of phase one and then phase two for sure. And then a lot of it just goes back into the blood, clear out through the kidney. Uh, there's benzobutyrphthalate, which looks a lot like dibutyrphthalate, the one I studied, except that one arm is a benzene instead of, kind of like just a regular branch like dibutyrphthalate, like a butyl. It has that one actually it's dose dependent, so specific doses, and it's a very, very old study done actually here at U of A in pharmacy. Um, they found that it kind of switches from urinary to bile, and why? Not sure. It
That's
must be some
interesting,
kind of
especially
injection. Hmm.
it's interesting, especially with aspirin being the one of the most commonly prescribed enterically coated medications, and people who take that for coronary artery disease often have renal impairment as well. So if it's occurring in more commonly in the urine, depending on the specific phthalate, that those people would be at higher risk, I would think.
Yeah, I don't know if the aspirin coating has dibutylphthalate though. The medications that have it will have a warning on it, and it tells you how much dibutylphthalate it has. At least one of them. I try not to mention them by name because I don't want to get sued ever. But in case they say I'm giving them bad rap, but there's I think Asacol has it on the box, tells you how much DBP is on it. but I don't know. I don't think I've ever seen it disclosed in aspirin though. So,
Are there alternative compounds that can replace the phthalates for enteric distribution? And if so, is it a problem where the characteristics of the phthalates that allow them to be helpful for enteric distribution are also the characteristics that cause toxicity, and therefore any replacement would also have adverse effects? Or is
mhm.
it easily avoidable?
Yeah, phthalates are having similar problems as BPA is having. So bisphenol A, they made like S and F
Yeah.
and all these other different types,
Yeah.
and they still retain that physical characteristics. So for phthalates, there are a lot of replacements. I would say a lot of them are equally or worse, bad. A while back, we did experiments with something called acetyl. Um, ATBs, acetyltributyl citrate. And it's a substitute for DBP. It can be used in like nail polish and they can put it on the coating of medications. And we tested it. It didn't exactly do the same thing as DBP, but when we tested it in the in vitro system, it kind of showed positive hit on the andro follicles when we gave the whole animals, we actually saw that it started killing the follicles early before they got to andro follicles. So other people demonstrated that it can activate like AHR, like aerohydrocarbon receptor. Um, no, that's not a good way to go. Um, so yeah, so there's data showing that they're just we haven't been able to create good replacements for them.
Okay, I have another question. This is like a lot less technical than other questions we've asked you. How on earth did you get female mice to eat a gram of a phthalate every day?
Yeah, so we do actually I didn't describe how we do it. We do pipette feeding. So it is dissolved in tocopherol strip corn oil. And the lower doses and the control, they love it. They put their little paw on the pipette tip when you're feeding them. They're really happy. The high dose, you actually have to restrain them pretty good and pipette it into past their cheek and make him swallow it. We prepare a solution so that we can deliver the dose in about maybe 40 microliters. So it's not so much in their mouth. But they don't like that high dose. We don't use it anymore because now we're doing mechanistic studies on the low doses. But yeah, and it's very runny, much runnier than the oil. So you can see them like they have like this whole milk mustache
That's really
from it
nice.
that is clear, but it's like all over their face. But they're actually pretty cute to watch eat the lower doses. They really like them,
I
and they'll eat
tried
it all.
that for the BPA study
Mhm.
in corn oil, and then I also tried it in like milk sweetener. But um, the rats hated it so much. And then when I was able to get a rat to actually drink out of the pipette, she ate the pipette itself.
Oh yeah, they do bite it sometimes. Yeah.
Yeah.
Yes, you have to kind of go on the side and kind of it's a little bit of a battle, and they get trained over time. So like our mice at the beginning kind of fight a little bit, and then they kind of learn that if I just cooperate, I'll be put back into the cage soon. So yeah, when I was at University of Illinois, there were people doing work with rats and BPA, and they use Nilla wafers.
Mm,
They would put the dose into the piece of the cookie, and they will give
yeah.
it to them. I'm pretty sure it's time consuming because you have to sit there and make sure they eat the whole thing.
That's what I do now.
That's what you're doing, the
Yeah.
cookies?
Yeah, I
Yeah.
give them cookies. I got that from Heather. So,
And I wonder, yeah, because I think the people that were doing it there actually were following her protocol. Another, I don't know if they've done it with BPA, but there are studies that have done estradiol, so they're feeding animals estradiol, and they were using Nutella.
mm,
So, And
Yeah,
for the monkeys, we have a non-human primate experiment that is going to be starting this year, not here, but a collaborator. And they're going to be trying peanut butter or Kool-Aid because the monkeys like Kool-Aid.
that sounds like a great plan.
So,
We had butter as a backup plan if the treats didn't work. That was our next one. Huh.
well, yeah, it's challenging. Yeah, I never tried that with rats. We've always used mice, which are, mice are they behave a little dumber
Mm.
than like more animal-like than rats. I think rats are a little smarter, kind of judgy. Yeah.
Yeah, we have
Your
big
face
feelings.
froze like
Yeah.
I feel like rats really look at you.
Mm.
The few times that I work with rats, I feel like they look at you
Yeah, no, they
and
have a lot more
think.
going on.
Yeah, I had like times where I was picking up rats before the lights went on, and when I was a PhD student, and then I was bent over and I go up, and there's like a rat like really looking at me. It was totally like Jurassic Park, clever girl moment. I was like, oh,
Oh no.
like another rat over here, clever girl. So yeah,
It sounds like the start of a horror movie.
yeah, yeah. No, but being recorded talking about rats, so please don't send me to the authorities.
Oh, no. Um, okay, this is a question that I wrote down, but again, this is a very selfish question to ask. We have new bedding in the animal facility, and I have observed a lengthening of met estrus for my rats for multiple cohorts now. And I'm wondering if you're observing this with mice, if their bedding changed too.
Oh, we're starting a study. So right now we haven't been doing. Well, we do have a study. I'm gonna find out if that was before the bedding or after. If not for sure in January, we're starting two dosing experiments that will have smears done. I
Mm.
can check for sure and see if we see the same thing. I would say I don't know if there's a list of components or ingredients for the bedding to be able to look at. Um,
Yeah, I'm sure
would be
Tally um, has the information on hand.
hmm Yeah, it's to find out. Like I will look at it and see if it happens with the mice too. But I don't think other than that, I don't know how else if they have published studies on that bedding or anything.
No, they don't.
Hmm.
Yeah.
Yeah, I mean that's how BPA was discovered. Something weird started happening with the animals. So
Yeah.
it's good to have your eye peeled for those things.
Well, the last cohort also, a whole bunch of them had infections. So there was just chaos going on.
Oh
Um, yeah, and
gosh.
we think that the new bedding increases the risk of them getting and spreading infections.
Hmm. Does the new bedding cause less cage changes because it does something better?
Mm-hmm. Yeah, it's an excuse for worse habits.
Yeah, so it might be just a little dirtier, maybe more chemical. Are
Yeah.
they on ventilation or are they self-standing?
Uh, the ones with the green lids.
Oh, I don't know. I haven't been there in a while. Do
Oh,
they plug into a
yeah.
air thing? Yeah.
Yeah.
So they're getting ventilated. If they were like static, so what they call them,
Mhm.
I've complained so many times I don't want my mice to get st on static. And we use special caging that doesn't have BPA, so um kind of like have special racks and they hate us because of that. Chicken.
Oh, another thing I was wondering about, you said that you're going to do 9 phthalates in a mixture for combined exposure. How did you determine which chemicals and at what doses to do for that? Because it seems like there's so many options there. Was there a
Mhm.
human study that was based off of?
Yeah, so on those follicular fluid studies, they actually show you the list of the phthalates that were detected. So based on those metabolites, we can determine what's the parent compound that belongs to them. So that's the first step. These are the 9 that keep being detected. And so then we selected the phthalates that were found in studies that showed linkages between, associations between phthalate level and antral follicle numbers. So we wanted it to be epidemiologically based. There's a phenotype. So then we identified the numbers. Then we based on the amount that was detected in follicular fluid, we create a proportion. So like most of the time is this one called DEHP is the highest concentration, then DVP has this percentage of the mix. Phthalates are parent compound phthalates are liquid, so we create a stock of 1 gram that has different amounts of the 9 different phthalates at those proportions or percentages. And then that is our stock. And then to decide the concentration that we're going to give the animals, we're choosing for this first studies, we had to use allometric scaling. So we take, into consideration like the difference between human and mice in terms of surface area and metabolism to come up with an equivalent, animal equivalent, human equivalent of what people are said that are exposed to. And so all those different steps, and then we're actually going to send them off to measure, make sure that we're matching the humans. If not, then we adjust.
Okay.
Mhm.
That's very cool.
The long explanation of it.
Well, thank you for talking to us. We went a little bit over, but I really appreciate your time and I think your work's super cool.
Awesome. If you have any questions, you know how to find me. And great job doing these meetings. This is wonderful.
Oh, thanks. It's fun for us. All
Yeah,
right.
awesome. All right.
Thank you.
Bye.
Bye.